You may have heard the term birth asphyxia. That's just a fancy term to mean decreased oxygen to the fetus. And a fetus can suffer birth asphyxia a variety of ways. You may know that a baby doesn't breathe on his or her own in the mom's uterus, but relies upon the placenta and the umbilical cord to get its oxygen through the blood flow from mom into the baby. So if that blood flow is ever disrupted, either due to cord compression or other things that can decrease that blood flow, then that can result in something called birth asphyxia. And there's patterns that show up on the fetal heart rate tracing, which is a device that goes on mom, and it measures the baby's heart rate, and it also measures mom's contractions. And doctors look at the heart rate and they look at the contractions to make sure that the baby is getting adequate oxygenation. And if the baby is not getting adequate oxygenation, there's a distinctive heart rate pattern that shows up. These are called decelerations, and there's different patterns of decelerations. There's variable, there's prolonged, there's late, there's early, they can be persistent. All of this information is available to the nurse and to the doctor, and they need to act on that because that can mean that the baby is not getting enough oxygen. And you don't want the baby to not get enough oxygen for too long during the labor and delivery process, because if that happens, then that can cause a permanent brain injury. And there's ways to avoid that from occurring. You can intervene and you can slow down the contractions. You can give oxygen. You can turn mom. You can tell mom to stop pushing. And you also can do a C-section. And by doing a C-section, you're able to remove the fetus from that hostile environment. And you want to do that before the baby suffers permanent injury from birth asphyxia.